We are halfway through the opening statements at this point, halfway to our Q&A section, but I'd now like to introduce, arguing against the motion, Sally Pipes, author of The Top 10 Myths of American Healthcare, A Citizen's Guide. She is President and Chief Executive Officer of the Pacific Research Institute, a think tank based in California. She also comes from Canada, but not only does she argue against this notion, 2 years ago she completed a personal journey and became a citizen of the United States. Sally Pipes.
I'm against the proposition that universal coverage should be the responsibility of the federal government. I do think that everyone here would agree that the key goal for America is affordable, accessible, quality health care. The question is, how do we achieve that goal? There are two competing visions for health care reform in this country today, and also for achieving universal coverage. One focuses on government, mandates, and taxes, while the other focuses on free markets, innovation, and empowering consumers. Today, that government vision is on the rise. The long-term goal of most Liberals is a Canadian-style, single-payer, Medicare for all health care system. These Liberals tell us that socialized systems like those in Canada and Europe are better and cheaper and can provide universal coverage for all of us. They also cite, as Michael did, life expectancy and infant mortality as evidence of the superiority of these systems. Well, let's look at life expectancy. People who make this claim usually note that life expectancy is higher in Canada and Europe. The World Health Organization ranking does not measure, though, the quality of a healthcare system. The World Health Organization ranks systems that treat people equally higher than those that treat people well. Now let's look at infant mortality. The U.S. does have a higher infant mortality rate than Canada. Hence, their government system is rated better. The reality is that the United States, with its superior neonatal care facilities, has allowed more high-risk babies to live. But this also pushes the infant mortality rate higher because of a greater number of at-risk births, babies being born. And in other countries, many of those at-risk babies do not live and are not counted in infant mortality statistics. Earlier this year, a woman in Calgary was expecting quadruplets. There wasn't a single neonatal unit for that woman to deliver her babies. She was airlifted to Great Falls, Montana, a city of 55,000, where she successfully delivered her quads. I'm from Vancouver, Canada. I was home 3 years ago visiting my mom, and the front page story in the Vancouver Sun was, pregnant mother with twins airlifted to Edmonton, Alberta. When they came back, the husband in the interview on the front page of the Sun said, the Canadian healthcare system is that of a third world country. Now let's look at adult cancer survival rates. A study published in the August issue of the British journal Lancet Oncology said that America is much better at treating cancer than Europe or Canada. Researchers found that Americans have a better survival rate for 13 of the 16 most prominent cancers. For example, breast cancer survival rate among American women is 83.5%, whereas in Britain, 70%. American men and women are 35% more likely to survive colon cancer than their British counterparts. Now, I have discussed the data, but let's look at the reality of universal coverage systems in Canada and Europe. Michael Moore, in his movie Sicko, where I have a cameo appearance, points to the wonderful healthcare systems in Canada, France, England, and Cuba. And he says they're all free. The U.S. does spend, as has been pointed out, 16% of its gross domestic product on health care, while Canada spends in the range of 10 to 11%. The reason that Canada spends 10 to 11% is because the government sets a global budget and says that's what we're spending. And what is the result? Long waiting lists for care, ration care, and a lack of access to the latest technological equipment. Today in Canada, there are 827,000 Canadians waiting on a waiting list for procedures. There are 3.2 million, or 10% of our population, waiting to get a primary care doctor. The average wait in 2007 from seeing a primary care doctor to getting treatment by a specialist was 18.3 weeks. That's over 4 months. Canada ranks 13th out of 24 OECD countries in MRIs and 18th out of 24 in CT scans. When I turned 50, I know it's hard to believe that I've turned 50, but when I did, my doctor here in San Francisco said, "You have to have a colonoscopy." And I said, "Well, there's nothing wrong with me. I don't need a colonoscopy." Well, anyway, I had one. But my mother in Vancouver, Canada, 3 years ago, July, started feeling ill and was convinced she had colon cancer. But her doctor kept saying, "You're old, there's nothing wrong with you, go to bed, sleep more." Finally, in December, my mom started hemorrhaging from her colon. Her doctor said, "You have to go to the hospital in an ambulance to get service in the emergency room." I could not take her. After being in the emergency room for a number of hours, she was then transferred to the transit lounge, where she waited for 2 days to get a bed in a room. But she was not counted as waiting in an emergency room because she was in the transit lounge. The issue is that she was too old, it was decided by the healthcare system, to have a colonoscopy when she was convinced that she was ill. And what about people with government coverage wait and wait in socialized systems? Except the politicians. Belinda Stronach, former Canadian MP, opposed any privatization of Canadian health care. And yet, when she was diagnosed with breast cancer in June 2007, on the advice of her doctor, she flew to UCLA and had her breast surgery and paid for it herself. As my friend in Vancouver, Dr. Brian Day, orthopedic surgeon and head of the CMA, Canadian Medical Association, told the New York Times, Canada is a country in which your dog can get a hip replacement in under a week and in which humans wait 2 to 3 years. Is this the kind of government-run healthcare system Americans desire? Think about the post office. Think about the DMV and the handling of Katrina. A majority of Americans rate the quality of our system as excellent or good. In Canada, according to Decima, only 33% rate the system as a grade A or B, and 22% say it's failing. Canadians intuitively know that long waits are the outcomes of government-run systems. While we can no longer deny there are problems in American healthcare, markets, consumer choice, and innovation will solve them, rather than putting the government in charge.
Thank you, Sally Pipes.